All right, now I want to move to the local level and I want to talk about Washington State. My main argument is that people are worried about rising cases in Washington State and less rising, but still rising hospitalizations. There's the worry that we'll be the next Florida because this happened when we were getting all those things about the cases in Florida going up and up and up. Well, Washington is not going to be the next Florida. As I said in the last video, Florida is actually looking better now. But let's just talk about Washington here. I want to zoom in on that because I've been collecting data at the local county level for Seattle, at the state level, and I've been keeping, of course, the closest eye on this because this is the place where we can actually affect this. You know, that's the amazing thing about this. It's partially like a natural disaster, but it's partially like something that we can control. We have a limited amount of control. The one thing I want to warn you about is going too far over we have no control, so why should we do anything or even try to stop it? Don't say that. But also don't say that we have complete control. If only we did X, Y, and Z, we wouldn't have any problems from this virus. This virus is extremely infectious. It is easy for it to get through certain barriers. There's a distinct possibility that it passes through in tiny aerosols that are harder to keep out of your system, that float around for a long time. There's lots of evidence like that. So neither can we completely control it, but neither are we completely helpless. So we want to find the happy medium where we aren't going around and blaming ourselves all the time whenever there's an outbreak. But also we don't want to say there's nothing we can do. We can't just throw up our hands. So the governor just announced that our reopening plan has been paused indefinitely. And that word always gives me a little bit of worry. The side is saying that rising cases, hospitalizations, and deaths have been happening statewide. And there's a way that you can look at the data that's a true statement, but it's also spun a bit. Rising is not rising out of control. The rise that we're seeing looks like it is a slow, linear, controlled rise if it is a statewide rise at all. I'm going to show you the data about that. So first of all, here's a case. The blue line is cases, and I've just normalized it to be on the same scale as the percentage that I show. And so that's cases, and cases statewide have definitely gone up. Now remember that testing has gone up as well. In fact, testing has quadrupled in this context. So cases have about quadrupled, but testing has also quadrupled. So what's happened to the percent positive rate? How many tests come back positive? And that's the orange line right here. And you can see that overall that orange line is declining. There was this nice drop about a month ago where we actually dropped all the way down to about 3% positives. But then it's risen again with this new semi-outbreak, whatever you want to call it. It's definitely an outbreak, so I'll call it that. But notice that it is now up to around, it rose to around 6%, and now it's down to around 4 to 5% with a little rise lately, but this is not the same rate of rise that we've seen before. Who knows what's going to happen in the future? But what we do know is that this is actually moderately okay according to the WHO definition of are you testing enough to capture what's going on with the disease. Their definition is 10%. So you see, we've always actually been within this definition. We were pretty close early on. The orange line is now about half the line that WHO says that you're not testing enough to capture what's really going on. So it looks like we really know what's going on, and note that cases have been flat for the past week or so. So this is not exponential growth. This is not Florida style, unless you want to say that it's Florida style for the past week, in which Florida cases have also been flattening out. Here's my favorite site that goes through and updates for all three types of data to July 31st, you see here. And if you look at this, you can see tests have gone up, positives have gone up. And positives have actually, gone up in about the same pattern that tests have. That implies that the percentage has held steady. I would love to see this get down to 2 to 3%. But right now it's hovering around 4, 5, 6%. But that's better than it was around 8, 9, 10% earlier in this. So this outbreak is not like the other one. Much more testing, much lower positives, and lower hospitalizations. Hospitalizations have gone up over the last couple of weeks, but I want to point out that it's still very low. Let's zoom in on the hospitals. At the lowest point, hospital beds were, by my estimate, about 3 to 5% full. So that low point in the purple graph represents about 5% of the hospital beds full with COVID patients. If that's true, it's about doubled from there, and there we have 10% of the hospital beds filled with COVID patients. Again, my biggest question, what can the hospitals handle? Is this going to go up exponentially? Well, you don't see any sign of anything beyond a linear increase right now. In fact, I'm hoping that this will follow the positive percentage line and flatten out from this point. That's what's happened in other states. And so from looking at everything else that's going on, the only way around this, around it flattening out from here, in my view, would be if we suppressed it somehow too much, and we have more of a susceptible population than the other states do. I don't think that that's what's going on. We'll have to keep an eye on this, but I don't think it's going to go up exponentially, and that's the one thing that everyone's most afraid of. Definitely keep a close eye on that. If there's signs that it's starting to go up exponentially, then there's definitely a big worry that we'll need to do something, change the things we can control. It's like the old serenity prayer. I don't know if Lord help me to control the things I can control, let you take care of the things I can't control, and to know the difference between the two things. We need to know what we can control and what we can't control, and we can partially control this. Thankfully, the deaths curve is low and flat. We're getting about 10 deaths per day on average from COVID statewide out of a state of 8 million people. I want to keep that number as low as possible, but I also am not sure how much we can control it to bring it to zero. What other prices would we have to pay to bring that number down from 10 to 0? It's a big, nuanced conversation. So let's look at the King County level. You can actually pull up this data for yourself off the website, the dashboard. You can see positive cases for King County. They appear to be flattening out. Remember that the most recent data, it looks like it's going down, but it always looks like it's going down because it takes time to enter the data. So I got to say that at least it's not going up before the gray part. You see how it's flat there. So cases may be flattening out in King County. And hospitalizations, this is newly hospitalized, and you see how it's been flat. As cases have gone up, hospitalizations have been flat, maybe creeping up, and that's why it's accurate to say hospitalizations are rising. But when you look at it compared to the crisis that we were in April, they are at 1/5 of the levels that we were at there. This is something the healthcare system can manage for right now, and there is not a sign of exponential growth. Deaths are following the hospitalization line. They are staying low. They are ticking along for King County that you're having, 1, 2, 3 a day. Each of these deaths, like I showed for the in memoriam, is a tragedy that we should prevent if we can. But my question is, what can we prevent? What can we control? This is a big and nuanced question. It's not going to be captured in 280 characters or less. It's going to be captured by watching the data for weeks. This represents weeks. And this represents a low and even flat and even declining death rate. You see how deaths are going down in King County. And they're flat in Washington State. So that's what I have contest. I contest somebody who sees any rise at all and says that it's rising and it's therefore an emergency. It's definitely call for caution, but I don't see exponential growth in these numbers. And I'm showing them to you so that you can look at them and see if you see exponential growth as well. Here's the case numbers for Snohomish as well as King, and because they are geographically well-mixed populations, we can see that they generally follow the same lines. In fact, Snohomish is about exactly 1/3 of what King reports on the whole, and you see the data's noisy, so you can't watch any single day, but the data's noisy, and you have about 1/3, the orange line for Snohomish, is tracking pretty close to the king line. They're not even rising at the same rate anymore, again, accounting for the noise, but it looks like they might be flattening out and or going down. This is not corrected for increased testing at all either. And so let's turn to covidprojections.com. They even have a projection for King County itself. So let's look at Washington State. It's not projecting exponential growth. There is an uncertainty of possible exponential growth in November, but there's no certainty about that until we get closer. And basically, I know that the modeler GU put in this uncertainty because of epidemiologists saying we have to account for the possibility of a second winter wave. It's not coming from the data right now, but then again, we aren't in winter right now, so we really don't know. But I think this accurately puts in what we know and what we don't. And what we estimate based on the data right now is a flat curve of newly infected, which should go with the hospitalizations. King County, another flat curve, a low flat curve, and again, the possibility of exponential growth is all the way out in October right now. Even accounting for this possible exponential growth, deaths are not projected to exceed what we've seen before in King County, and they're projected to be flat. And I could show you the same graph for Washington, but I just didn't do it because it looked exactly like you'd expect. It looked like the King County version of that. So, for people who are worried that Washington may follow Florida's path, I don't see any evidence of this. And again, this is my favorite way to show the path, to show the hospitalizations on a drop-down plot. Washington in Seahawks colors way down there at the bottom. It is going up. Hospitalizations are rising on a week-to-week basis. But it's not rising at a slope that is greater than those other slopes that we're seeing. Again, this is also a log plot, so that should go with how you interpret the slopes. The main thing is Washington's way down on this graph, even though in population it's in the middle of this graph. It's not following the paths of the others, and the others have been showing signs of dropping down now. So if Washington follows Florida's path, then proportionally they should be pulled down by this gravity at some point, because they're going through a linear increase right now, and that in all these other states, that increase has been flattening out and been pulled down. The one caveat, this is based on the path of all the states that have gone before. What if there's something different? What if something about winter fundamentally changes the transmission of this virus to result in that second wave that we've seen? I actually don't think that that's going to be the case, but what I think doesn't matter. What matters is what happens in October and November. But let's just say, based on what we've seen now, we actually have an improving situation for at least a couple of months. And we have things to keep an eye on. And I want to say this again and again. I've seen in the data and from talking to people in the hospitals that the IFR must be down from what it was originally. It must be down, and I want to repeat that the GU's analysis that I showed in the last one shows that the IFR is now 0.25%. I'm actually comfortable enough with that to be making policy based on that. So again, cases are bad, but they're 0.25% bad, where before they were 0.7% bad. Flu cases, by the same standard, may be about 0.1% bad. So we've gone from being 10 times worse than the flu to being about 3 or 4 times worse than the flu. And again, this is age average. This is not accounting for risk. This is not accounting for anything except for the fact that we have 5 months of experience with this virus. And we've seen it do these things where we have outbreaks that do not look like New York City's outbreak. We have the Florida-style, Texas-style, California-style outbreaks. 3 very different states that had 3 different populations and 3 different approaches to containing it. So I don't want to go around and correlate which of the approaches goes with it going down. We can ask that question in more detail by looking at the data in more detail. For right now, let's just say that the path that most states are following is a path where you have a peak that is manageable and then decreases, at least for these summer months. It looks like our hospitals are doing their job. They are treating the patients, they are saving all the ones that they can, and we have increased the survivability of this virus. It is still bad. Okay? This is not a call to suddenly throw up our hands and say everything's okay now. But it's also not a call to be certain that things are going to get worse. Because in Florida, even Louisiana, Texas, all these states that I'm showing on this graph that you see going down, it's not getting worse. Why? And how can that be transferred to other states? I don't really know yet, but I think that this is good news that doesn't get passed around in the same way that record-breaking case counts get passed around. This is a drop that's not record-breaking, but it's what we were all hoping for. So because I was hoping for this, and because I said I hoped that it would happen 2 weeks ago, I want to show you that it's happened, and I want to say, let's find that medium between what we can control and what we can't control. And let's work with what we've been given. What we've been given is a situation that is improving. And here's the data that shows it. We can talk all about what you think about the reliability of this data, but this comes from very different states with very different politics in all of them. And each of these is independently gathered and reported by the state. This is not being suppressed at the state level. And that's the only data that I actually go through. So yeah, thanks for listening. We will check back in to see if this trend continues.